Great, thank you ever so much for that, and thank you everybody for joining us. Said, wow, what an amazing response, which hopefully shows the growing interest in PPI nowadays. So I'm going to be talking for probably about 35 minutes, and then there's going to be some time for questions and a bit of discussion afterwards. So we're going to be thinking about involving patients and the public in literature reviews. How can we go about it, and also why would we want to? So I'm just starting off a little note on terminology. I'm of the generation when anybody that said PPI to me, I immediately thought of payment protection insurance. But thankfully, times have moved on from that now, and PPI as an acronym is becoming more and more well known. Just to mention that certainly in the UK, nowadays people are often starting to use PPIE, so patient and public involvement and engagement. In this presentation, I'm mostly going to be talking about involvement. So actually involving members of the public as advisors during a literature review process. And as we all hopefully know, that this is very different from involving members of the public as participants in our research. So patients and public as advisors in our research. So just a little bit on terminology there. So what is involvement, just as a starting point? Well, it's very simply the art or process of taking part in something. But if you think traditionally about literature reviews, often when you think, oh, I'm going to do a literature review, you kind of have this image of a systematic reviewer or a literature reviewer kind of being buried away in probably a semi-darkened room, absolutely surrounded by source documents and books, and sort of having to sit there and work their way through beginning to review and synthesize all these documents. So kind of traditionally it's been seen as quite a kind of individualistic pursuit. Now the concept of research teams is coming in. But again, you still kind of think of doing a literature review as sitting down and just sort of looking at source documents. So if your image is of a reviewer kind of sitting away and beavering away, looking at loads of source documents, where on earth does this concept of involvement come in? Now, why should we even be starting to think about involving other people in our reviews? So there are kind of three what I would call basic rationales around why you might want to involve public contributors in your review. A moral or kind of a civil rationale, more of a tick box rationale, and then a value rationale. So thinking in terms of a moral or a civil rationale, certainly most of the research that we're doing in ScHARR tends to be funded from public sources. So if your research is being funded from a public source, shouldn't members of the public actually be involved? A second rationale might be that actually the public should know about research that's going on. In kind of open and honest and transparent research, again, we should really be trying to encourage people to get involved and know about the research that we're doing. Certainly in the field of health and care research, which is where most of my research is based, a lot of the work that we're doing is around care or treatment or services that are being provided to patients or the population more generally. So again, if it's a research topic that matters to care and treatment, again, shouldn't we be involving patients and public in our research? And then also, again, we hope that the research we're doing actually matters. It matters to society, it matters to people. So again, if the research does matter, shouldn't we actually be involving people? So that's kind of what I would call a moral or a civil rationale around why you might want to be involving public contributors. The second of these is the one that often people come up with. So the kind of, oh, my funders told me I've got to do PPI. If you're a PhD student, oh, my supervisors told me I've got to do PPI. And this was sort of as funders are becoming more and more aware of the role of PPI, they are insisting that actually PPI is part of funding applications, and that you're reporting PPI as your research process goes along. So a kind of a tick box rationale, yes, you know, I've been told I've got to do it. I need to go away and do some PPI. But hopefully, by the end of this presentation, most of you will actually have a better understanding of the third one of these rationales, which is what I would call the value rationale, that lay people can actually add value to a review. So I'm hoping that I will have convinced you that maybe you should be thinking about the third of these rationales. Okay, so that's thinking a little bit about the why of it. So I'm going to spend most of the rest of the presentation thinking about the how. So there's lots of guidance and guidelines available, certainly in the UK, that are really useful, and I'd strongly encourage people to go away and have a look at. So there's the UK standards for public involvement. There's lots and lots of work from NIHR, different guidelines for researchers. We've got briefing notes for researchers, work from RDS, the Research Design Services in the UK, again, have got lots of really helpful guidance notes. And there are beginning to be some courses around as well for both public contributors, but also these can be really useful for researchers themselves to go and have a look at. So certainly plenty of kind of guidelines or guidance documents around. So what I wanted to do particularly in the session today is actually do something a bit more practical. So kind of move beyond some of the guidance and really try and give you some examples of work that we've been doing in Sheffield, and really thinking very practically about how you can actually involve public contributors. So that's kind of where I'm going today, is trying to do something that's a little bit more practical. I'm sort of basing it on all the emails and the conversations that I have from colleagues and staff. I get emails all the time, you know, what can I do? How do I do it? So this is kind of where I've based this presentation. So just a quick word just to begin with about the model that we tend to use in ScHARR. So we have several evidence synthesis centres. We have a public health evidence synthesis centre, a health services and delivery research centre, and a new enzyme research centre as well. So these are all kind of evidence synthesis centres, and they have programmes of different topics up to 5 years. So within the model that we use what we would call a 3-tier model. So we always have a PPI co-applicant. So they help us with developing a proposal and kind of co-leadership with a university member of staff. So that's our first tier of PPI. We also have a strategy group or a standing group, and these PPI advisors are with us for the lifetime of a centre. So these are experienced PPI contributors, and they help us with overseeing the way that PPI works, think about training, and also they're absolutely brilliant in terms of inputting into if we've got a very time critical project or something where we need some really rapid input from advisors, then we go to our strategy group. So that's the second tier of our involvement. And then our third tier is we set up topic specific groups. So groups of advisors who've got particular expertise, maybe a health condition or perhaps a particular care service. So we set these groups up for the lifetime of that individual review. So that's just a quick note on our third 3-tier model that we use in the ScHARR is the School for Health and Related Research, sorry. So that's kind of our typical 3-tier model, which I thought might be helpful for people to know first, because lots of the work that I'm going to be talking about is from these evidence synthesis centres. So practically, how do we go about doing PPI in literature reviews? So obviously step one is go out and find some people. And here, it's really important that you think really carefully about the type of people that you want to involve. Are you needing people with particular experience? Are you needing people with particular viewpoints? A good example here is we did some work on sharing public health data. So we were really keen that our public advisory group had differing opinions. So some people who were really supportive of sharing health data, but also some people that had negative views. So that was really important when we were actually finding the type of people for our advisory groups, just to make sure we had that balance of viewpoint. So thinking really carefully about who exactly do you want in your group, what kind of mix of people. You particularly need to think about sort of demographics, so to get a mixture of ages, background, location in the country. Sometimes when we put out adverts for PPI advisors, for some reason we seem to get loads of people that are based in London and the southeast of England, and obviously their experience of health and care services can be very different from perhaps somebody from a more rural or a remote area. So again, really think carefully about who are the people that you actually need in your group, and have you got a really nice mix or balanced group. Obviously thinking about how many people you need. I mean, our groups tend to have probably six to 10 contributors. Then the thorny issue about how are you going to find them? Are you going to use sort of third sector organisations? You know, are you going to use existing networks? I'm really thinking carefully about where are you actually going to find the sorts of people you need. And then the third one on this slide, when years and years ago, when I first started doing PPI work, we used to kind of put an advert out, and we'd get maybe 3 or 4 responses, and we kind of grab everybody that had responded to the advert. Nowadays, we do tend to get quite a nice pool of responses when we put an advert out. So we're in a much better position of actually being able to select the sorts of people that we want, to make sure that we've got a really nice mixed group. So thinking about how you're going to actually go through that selection process is really important. Certainly telling people that you're going to select is really key as well, so that people, you know, are replying on that understanding. But thinking really carefully, you know, how are you actually going to pick out the people that you want for your group? So that's kind of finding people. The next step is actually thinking about actually what you do with people. And this is often when people get in touch with me. You know, I've got a group of people together. What on earth am I going to do with them? I've got the first meeting coming up next week. Please, can you help me? Tell me what I need to do. So I'm going to spend a little bit of time just thinking practically about what can you actually do with your public contributors. So I would really strongly encourage people to spend a bit of time thinking about what you actually want and what you actually need. So what do you want them to help you with within your literature review? If you can't think of anything that you want them to help you with, you know, are you really needing the PPI group at that point in the process? Where is their input actually needed? And particularly, how might it actually contribute to your research process? You don't want to get into that kind of tick box scenario that actually I need PPI, I've got to have PPI, but actually I don't really know how on earth it's going to contribute. Hopefully some of the other slides I've got will actually give you some ideas on how it will contribute. So what I tend to find is that public contributors really give us different input at different points in the literature review process. So that's really important to think about, that actually roles can change according to actually what type of review you're doing and where you actually want their input. So you might want to zoom this slide in a bit. Sorry, it's some of the text a little bit small. There is a little magnifying glass with a plus sign if anybody wants to zoom up this slide a little bit. So what I've done is actually set out a typical literature review process with all the different steps, and then we'll just have a little think about actually how can you contributors help for each point in the process. So the first one is around actually getting your research question, defining what you're going to look at, what you're not going to look at. And here public contributors can actually have a really helpful role in terms of thinking about what's important. Are you actually asking the right question? Is it a question that really matters to members of the public? You know, is there something actually that you're missing? Should your question be slightly tweaked? You know, is it actually not really the question that's important? So actually talking to people at this point is really, really helpful in terms of actually starting to get your review going. You know, what sort of things are you going to include? What sort of things maybe should you not look at? So that's really, really helpful. So then moving on to starting to look for your research. Again, public contributors can be really helpful in telling you about any local initiatives that's going on. If you're looking for grey literature, again, there can be really good sources of things like charity websites or public groups, patient groups. So again, they can really be helpful in sort of getting you into those kinds of networks. Often they've got really, really good little black books with loads of contacts in, so that actually you can really get to advisors or people that actually will be really helpful in terms of your review. So next stage is actually your data extraction. So you've got all your literature and you're taking out the key data from each study. Here again, public contributors can be really helpful in terms of actually helping you with what you actually want to take out from the studies. You don't want to get to the end of a review and then find out that there's something really key that actually you haven't been extracting from the studies. So you really don't want to start going back again and start re-extracting them. So public contributors can be really good at actually capturing, you know, telling you what the key things are that you might want to be picking out of a study. Then at your data synthesis point, thinking about what's there, what's missing, what does it all actually mean? So actually other people coming along and taking a little step back, a sort of slightly helicopter view on what you found out and starting to tell you what it all means. And then in the final stage of your review, what are the takeaway messages? How best to communicate these findings? Who are the people that need to know about what you found out? And what's the best way to actually tell them about it? So at each stage in the review process, public contributors can actually add value to your review. So what we wanted to spend a little bit of time is actually just giving you a few examples from some of the reviews we've done, just to hopefully kind of crystallise how the value can actually be added, and exactly what we did with public contributors, because again, that's sort of a typical question that people ask me. Yes, you know, I need I need their contribution at this point in the review, but I'm not really sure how to go about actually doing it. So I thought a few examples might be useful of exactly the sorts of things that we would do with people. So in terms of that sort of early stage of the review, so understanding the topic and refining the question. So one of the examples, we were doing a review on strategies to reduce admission to hospital from care homes. So at our first public advisory group, we were really keen to understand different people's experiences of admission from care homes. So what actually had people experienced? You know, what had their relatives experienced? What were the particular things which had gone well? What had not gone well? And very interestingly, we wanted to know how the services actually worked in different areas. And this gave us a really helpful background when we actually started looking at the literature, and particularly in terms of how different services were working. You know, it gave us a guideline really on what kind of things we ought to be trying to find, and really just really help the research team with just getting to grips with that new topic. So another example, we were doing a review on urgent care services for vulnerable groups. So that was the topic that we'd been given. And we were really interested to find out from our public advisors actually what people understood by vulnerable groups. So at our first advisory group meeting, we spent a little bit of time asking them to think of what they would actually think of in terms of being vulnerable. So who were the sorts of groups of people that they would term vulnerable, and then what perhaps are some of the characteristics of vulnerability. And this was, again, really helpful to our review in terms of getting an understanding of the topic. And also later on, when we started trying to look at some subgroups for subgroup analysis, again, it was really helpful in shaping the way that we actually started to think about our subgroups. So again, their input at that early stage of the review have been really, really helpful. So some examples of the sorts of things that you can do with your groups later on in your review. So where you're trying to look at understanding the evidence. We tend to do quite a lot of kind of vignettes or pen portraits. So we would take some findings of the review and turn them into little scenarios or little case studies or vignettes. If there's sort of different interventions that we've come across, you know, we might write out like this one, sort of a little scenario, and ask our public advisors to actually think about that intervention or that approach, and really think about, you know, what actually might work about that, what might not work about that, you know, how might that intervention actually be taken up by members of the public, you know, what would be the acceptability to patients of something that's been mentioned in the literature. So sort of taking the literature and turning it into something a bit more real life for people, and actually getting their insights into actually what might the evidence that we found look like in practice. So that is a really nice way of using people. We've done it a lot in realist reviews, where we actually construct lots and lots of little scenarios from the realist reviews, and then take those back to our public advisory groups. So definitely that is well worth doing. Another example, we did a review of factors affecting the mental health and well-being of students. And here at the beginning of the review, we asked our public advisory group what they thought were the factors that affected mental health and well-being. And then later on in the literature review, we went back to them again, and we described the factors that we'd found and did a bit of a kind of compare and contrast with what they told us about versus what actually we'd found in the literature. So from there, again, it's a little bit tiny, sorry, so you can use your zoom in if you want. So what we did from that was actually develop a framework of factors that actually we'd found in the evidence, but actually we could find what was missing from the evidence. And this was actually really, really helpful when we were writing up the review. So it sort of could underpin some of our recommendations for research, which obviously is a really key thing to do from any literature review. So, you know, we could actually compare what we'd found with what was missing, because often in these reviews, it's not all about what you found, it's kind of what isn't there as well. So public advisory groups can be really, really helpful in terms of doing something like that. Another activity which we do a lot is kind of sorting or prioritization activities. So we would take the findings of a review and sort of turn them into statements or different elements or factors, and then we would sort of do lots of activities around that, just again to help us with understanding what the evidence that we found actually means. So it's all about kind of turning that research evidence into something meaningful. Okay, so then in terms of the final stages of the review, so presenting the findings, we do a lot of kind of production of diagrams and logic models and pathways and frameworks and that sort of thing from our literature reviews, and that's really, really helpful to take those to members of the public and get them to have a look at them for you. So asking things, you know, does the diagram make sense? Is it helpful? Getting them to look at terminology again is really, really useful. Thinking about things that are missing from the diagram. So that again is something that's really helpful towards the end of the review, is getting their help in terms of actually putting what you found, what the evidence says, into something that's a little bit more meaningful. So helping us with that interpretation of the evidence. So definitely highly recommend using advisors to actually help you with developing things like diagrams. Another thing which we found has been really useful, when you're doing a review, you tend to get really kind of bound up in what you found and kind of knee deep in the evidence and the complexity of the evidence. And public advisors can be really helpful in helping you just kind of step back a little bit and actually think from a distance about actually what you found. So often we'd ask, we'd tell them a little bit about what we found in the evidence, but then we would ask them to summarize the main findings. So what actually would they be taking away from it? And then in terms of what they think we've found, actually what do you then think needs to be done? So we found this, what now needs to be done? And again, that's a really helpful thing, because as I said, sometimes you just get too knee deep in the evidence, and you need somebody just to sort of stand back and take a little view on it. So often something which I would do is kind of is get people to write pretend newspaper headlines. So, I've told you about the literature review and what we found. If you were writing a newspaper headline or a headline sentence, what would you actually do? What would you take away from what I've told you? So again, really helpful activities that your advisors can help you with. So dissemination impact, I'm sure most people are very familiar with plain English summaries. I've been writing plain English summaries for many years now, and I can sit and write a summary, spend hours writing a summary, which I think is really good, and then I send it off to a group of advisors, and they absolutely tear it to pieces, and it comes back so much better than I wrote it. So plain English summary is really helpful to get advisors' input on. We tend to do a lot of sort of 2-page evidence briefings, which again are really helpful. Comments around wording, use of diagrams, actually are the images that you're using actually acceptable to people? Does it look right? Is it user friendly? So again, really helpful to get public advisors on input on something like that. Other ways of sharing findings, kind of co-producing, co-developing videos, presentations, obviously co-authoring papers. We've had public advisors writing short articles for sort of magazines and things. We've had advisors be involved in press releases, and also in also writing their own blogs, using social media to get your findings known about. Often, again, they've got really good networks that you can tap into to actually get your findings known about through different channels. Okay, so where are we? 25.2. Okay, so just some top kind of what my top tips would be really on involving members of the public in your literature reviews. The one, if there was one message that I would give to people, it probably is this first one, because I see so many people trying to do PPI and it all goes slightly wrong, because what they do is they kind of stand up and do a presentation, and researchers love talking about their own work, and then they do a 30-40 minute presentation, turn to a PPI group and they say, right, what do you think? So my top tip would really be that people are there to contribute, not just listen to a presentation about your study. Certainly people will find it interesting listening to a presentation, but it isn't really involvement. So, really think about what role members of the public want and need to have in your study. So that would be the one thing I would say that I've seen most people go wrong on is too much presenting. Another thing is really thinking about points in the process where you want involvement. Often people will put in a PPI meeting, say every 4 months or every 12 weeks or something like that. But really that isn't terribly helpful, because again, if you think about where you want involvement and why you want involvement, you probably want it at particular points in the review process rather than sort of in particular calendar months. So really think about the process. Links to my first point, be really clear what you want from people. Public advisors often say to me that, you know, being involved in a study was really interesting, but they just didn't quite know what it was that the researchers wanted from them. Public contributors want to feel kind of that their input's been helpful and useful to you. So make sure that you're really clear about what it is that you want from people. Watch out for jargons and acronyms, much like the ScHARR one, the classic one that I went into earlier. Really, again, when you've got in-depth into a piece of literature, then, you know, you sometimes forget that actually other people haven't read all the 93 papers that you've read. So watch out for jargon and acronyms. I think one thing probably I've learned over the years, more than anything else, is that things take much longer than you think they're going to with public advisory groups. I think I started off doing 1 hour public advisory meetings, and now I wouldn't touch anything probably less than an hour and a half. Because things do take much longer, and also you actually want people's input and involvement, so it's a real shame if you end up kind of rushing through things and don't have chance for full involvement and discussion. But definitely I would say that is a top tip. Things always take much longer than you think they're going to. Sending out information slides before a meeting, again, really helpful. I try and put send information out at least a week before, so that people have got a chance to have a read through if they've got the time. And often people actually, it's much easier for them to read something on their screen rather than from your PowerPoint. So yeah, sending stuff out, getting feedback from members about the meeting, really important. We co-developed a kind of an online survey, which we use at the end of every PPI meeting. We hunted around trying to find an existing one and just couldn't find what we wanted. There are quite a few around. Some of them are quite long and quite onerous. And the feedback from our members was they wanted something just very brief, very quick that they could fill in. So we actually ended up developing just a kind of online survey one using Qualtrics. So that's worked quite well. And then again, often a complaint from public advisors is that they never know what actually happened afterwards. So letting members know what you actually did with your input is really important. I know we're all guilty of that as researchers. You finish one study and you've moved on to the next one. But if you can really try and remember to let your advisors know, you know, how their input helped and actually what happened next, that would be really appreciated. Thinking about information needs, you know, perhaps you need to produce a kind of a jargon buster? You know, do you actually need to talk through basic terms that people might come across? Thinking about training needs. I think I saw a quick question flip up about that one. We did some bespoke training just on systematic reviews for our public advisors, which we recorded, and that is now available for all our public advisors. So it was, as I said, two bespoke sessions actually on what systematic reviews are and what the process is and how people might get involved in them. So definitely it's really useful and really important that you make sure that your training is in place for your advisors. Right, last slide. So there are obviously loads and loads of challenges in involving patients and the public in doing literature reviews. Absolutely massive challenge is finding a good mix of people. So where you advertise, how you advertise, where you go and try and find people, trying to get those members of the population that perhaps are less involved or less interested in being involved. I think that is just an absolutely enormous challenge for the whole world of PPI, really, is getting the people that you want involved. Managing people's contributions. Some researchers, perhaps who've had not much experience doing these kinds of things, really struggle when you've got sort of groups of people together, particularly where maybe you've got some more dominant members versus some members that are less comfortable talking in that environment. So thinking about actually how you're going to manage these contributions is really important. Don't get me started on payment systems. I'm sure that's something that lots of you have really struggled with. But yeah, making sure that there's a way of actually recompensing people for their time and contribution is a huge challenge. And then finally, the last one I was going to mention was about evaluating PPI. It's really important that we do try and make sure we've noted down how and where PPI has influenced our study, really to start building the evidence base for evaluating PPI. Okay, so that's the end of my presentation. My contact's on there, so if anybody wants to get in touch afterwards, do feel free.